soldiers, sailors, marines, airmen.
You are our greatest weapon of all.
First step in solving any problem is recognizing there is one.
It's time we started talking. Pain isn't something we thought.
All we can ever do for our heroes is remember them. And they gave up two lives, the one they were living and the one they would have lived. They gave up everything for our country, for us. They prayed for freedom and justice.
Some veterans not getting the timely care that they need. Less than 1% of Americans serving in uniform. Good news is that in recent years we've made historic investments to boost the VA budget.
What is it? Why should we care?
We should care about press freedom because we were informed.
In democratic societies, free, diverse, and pluralist media enable public debates and are essential checks
You don't
on
look
power.
satisfied. Let's discuss.
Hey guys, welcome to Vet podcast, a new episode. Today we are talking about disability ratings of Genitourinary System, and the VA awards disability compensation for each Genitourinary System conditions that is service connected, and the DoD will also rate service connected Genitourinary System conditions as long as they also make the service member unfit for duty. And for reservists, the condition must have occurred or resulted from an injury in the line of duty to qualify. So we need those reports. So let's go into the topic.
Yeah. The genitourinary system is comprised of two kidneys, two ureters, a bladder, a urethra, and any other genitals directly relating to urination, although the male testes are also included in the genitourinary system codes. The kidneys filter the blood and turn the waste into urine. The ureters then take the urine to the bladder, where it is stored before traveling through the urethra to the genitals, leading to the outside of the body. The process of the genitourinary system is broken down into two parts: renal, the functioning of the kidneys, and urinary, the functioning of the ureters, bladder, and urethra. The primary functions of the genitourinary system include the following: excretion of liquid waste products, regulation of blood volume, electrolyte regulation, acid-base balance regulation, arterial blood pressure regulation. Disorders of the genitourinary system include a range of disorders from that are asymptomatic to those that manifest an array of signs and symptoms. Causes for genitourinary disorders can include congenital factors, infectious diseases, trauma, or conditions that secondarily involve the urinary structure. However, many veterans experience conditions related to the genitourinary system as a result of service-related injuries or diseases. If veterans believe their genital urinary condition was caused or aggravated by their time in service, they should consider filing a claim for VA disability compensation. To honor the pyramiding principle, only a single rating can be given for multiple genital urinary system conditions that cause the same symptoms. If two genital urinary system conditions exist, each clearly affecting a separate function, for example, one renal and one urinary, then they can both be rated separately. However, if a single condition causes both renal and urinary symptoms, both cannot be rated. Only the rating system that results in the higher rating can be given. In most cases, the multiple genital urinary system conditions will be rated using all of the symptoms combined together, and the VA will choose the single code they feel best covers the overall genital urinary system disability.
Yeah, and to establish the service connection for that and this or that condition, we always use those three steps. You need to have a current diagnosis of the condition that bothers you, an in-service event or injury or illness, something that happened to you when you were in the line of duty or in the military, and then you need a medical nexus opinion linking those two, that you are suffering from something and it happened when you were in the military.
Yeah, try to give yourself the best odds possible. So doctor letters always help if they're willing to write them. So always ask. The VA SRD offers two main rating options for the genital urinary system conditions: the urinary rating system and the renal rating system. Additional ratings are given for conditions that do not strictly cause urinary and renal symptoms. The VA SRD offers rating for the following conditions of the genital urinary system: conditions of the bladder, the urethra, urinary tract infections, conditions of the epididymitis and prostate glands, conditions of the kidney, genital urinary system passage restrictions like hyperhidrosis, kidney stones, things like that, conditions of the penis and testes, tuberculosis of the genital urinary system, cancer and tumors of the genital urinary system.
So what kind of ratings we have for genital urinary condition?
So for renal conditions, the VA will determine the following ratings according to the VA SRD. 0% for albumin and albumin, right? 0% for albumin and cast are present in the urine with a history of nephritis, inflammation of the kidneys, or hypertension is present with an average systolic pressure of less than 100 or with an average systolic pressure of less than 160. 30% for albumin is 30% if albumin is present in the urine with either red blood cells or hyaline and granular cast or slight edema or hypertension with systolic pressure above 100 or systolic pressure averaging above 160. 60% for definite decrease in kidney function or hypertension with an average systolic pressure above 120. 80% if there is a level of 4 to 8 milligrams of creatine in the blood with persistent edema or overall poor health symptomized by lack of energy, anorexia, weight loss, weakness, or the inability to exert much energy. For the 100%, hopefully you don't want this, requires regular dialysis. The body cannot perform physical activity due to the persistent edema or the creatine levels in the blood or the severely decreasing kidney operation. So yeah, not fun.
Yeah, so this rating will be used to assess multiple conditions, and of course it depends on the doctor who go through your with your exam, and then linking the conditions that you have to VA ratings. So what are the 7 conditions that VA rates as urinary tract infection?
So many veterans are unaware that a urinary tract infection or UTIs can lead to complications like kidney failure and sepsis. The medical definition of a UTI is an infection of the urinary tract. Once you experience UTI, there are several genital urinary conditions that the VA will rate if your UTI symptoms match it close enough. Unfortunately, once UTI is in your urinary tract, the bacteria can transmit to nearby places in your body like your bladder or urethra. If you leave a urinary tract infection untreated, the bacteria can lead to serious and sometimes deadly complications. The Department of Veterans Affairs rates 7 conditions of the UTI that awards disability compensation. So if you're dealing with the UTI diagnosis, it means that bacteria have spread from the urethra to the bladder. Within 5 UTI categories, there are 4 types of UTI symptomology: acute, subacute, chronic, and reoccurrent. The symptoms are most commonly noticed after urination and include urine infected with bad odor, painful urination, or fever. Once the bacteria is traveling through common pathways in the body, even medical conditions may result from a UTI. The VA will award disability compensation for those suffering from UTI that results in number 1, disc disease, Disc disease occurs in one or more discs of the lower back, usually between the two vertebrae that become swollen and can cause lower back pain. The spinal cord disc suffers from a nerve damage, vascular problems, degeneration, or other issues. It can also impact nearby nerves in men. Disc disease of the lower back is most common for those over 50 years old. For women, they usually experience it earlier, between 40 to 50 years old, but this disease can result from UTIs. Number 2, prostate cancer. The prostate gland is a part of the male reproductive system in men. It lies just below the bladder and surrounds the urethra. The prostate gland secretes a milky fluid that becomes part of the semen. Prostate cancer begins in the cell of the prostate gland. It will cause normal cell growth rates to multiply in uncontrolled fashion and form a tumor. In most cases, prostate cancer growth will stop on its own, but other times it spreads beyond the prostate to other parts of the body. So the progression into advanced disease can be very slow when it's come to prostate cancer, taking years or even decades. It can also spread rapidly, in which case it becomes life-threatening. When you find prostate cancer early, you can treat it with prescriptions and medical procedures if you find it early enough. If it has spread to bones nearby important blood vessels or other organs, you may need more complex medical procedures. So get your prostate checked. UTIs, for number 3, that lead into obstructive disorders of the lungs. So common obstructive disorders are COPD or bronchitis. Another obstruction can be the result of UTI occurs when the UTI bacteria attaches to the velum. The velum is the flap of the soft tissue that lowers into the nasal cavity. The flap and its location protect your airway from food and water. If the velum is unable to close properly, we may end up breathing in food or water instead of air, and this can choke or cause pneumonia. Any obstruction of the lung airways can result in lung disease. All lung disease make it intensely difficult to breathe as the rate of breathing increases. You have less time to breathe the air out of your lungs before you breathe in during your next breath. It might sound a little odd, but a UTI can cause lung disease. But if it's left untreated, the bacteria causing the UTI will travel throughout the body. Weakening the lungs can be easily targeted for E. coli growing unhindered in the urinary tract. Number 4, kidney failure or impairment. The genital urinary system has many different parts and organs. The organs include but aren't limited to the ureters, bladder, urethra, kidneys, and prostate gland. The genital urinary system also performs many functions that diseases can hinder. This leads to a snowball of health problems that all started with the urinary tract infection. Veterans with health problems due to disease, disorders, or injuries to the genital urinary system may receive a 100% disability rating. Your rating depends on the degree of the severity of the medical issues, and hopefully you don't get 100% for any of these guys. Permanent damage done by temporary illness that was service-connected are all fair game for your VA disability application. So look into the things that are affecting you and if you could tie them into your service or not, because even though they might sound small or unrelated, they might be. For number 5, UTIs and prostatitis. There's no doubt the VA can help treat you if you have a UTI. The purpose of the VA uses to help you eliminate your UTI is to help maintain a healthy bladder. A healthy bladder means you have a proper urination amount passing through the urethra. The average person urinates approximately 12 times each day. Bladder function has many different factors, including age, gender, medical problems, and medication use. This frequency can change when men develop diseases associated with UTI, and one of the diseases is prostatitis. If a veteran has prostatitis, surgery is one of the medical options. Prostatectomy surgery results in the removal of the prostate gland. Removal of the prostate gland is the most common medical procedure for the treatment of prostatic diseases. The VA doesn't usually give 100% TDIU for just a single disability. They typically add up disabilities in the veteran meet the criteria like this. So when it comes to the unemployed, but we could just cut that out, right?
Mm-hmm.
That's like a little separate. For number 6, kidney stones. Everyone ages, and with aging comes health issues. And if you're a veteran and you had issues with UTIs as you age, this can impact your genital urinary system with stones in your kidneys or urethra. Uretic stones and kidney stones can result from aging and medical history in which you experienced previous bouts of UTI issues. And those don't sound fun. Number 7, erectile dysfunction. Definitely commonly known as ED. UTI in the lower tract often occurs as men age. Unfortunately, both aging and UTI contribute common pathogenic mechanisms which result in ED. There have been systematic studies with epidemiological data support that identify UTIs and natural aging as a comorbidity issue. So, stay positive and keep up.
Yeah, so that's it for today's podcast. If you have any of those things that bother you, that's probably would be a good idea to go visit VA and start lining out all the symptoms that you've been experiencing to your doctor.
Yeah. Always look into it, you never know.
Yeah, so and as always, do you have any like informational resources you would recommend and share?
A comedian I follow, Miss Pat's finally having her show release on August 12th on BET Plus called The Miss Pat Show. So if you guys are into comedy, you should probably watch that. I think that's going to be really big. Check it out.
And a quote or words of wisdom of the day?
Build your own dreams or someone else will hire you to build theirs.
Said by Farah Gray. That's it, folks. Thank you for listening. Until next time, over and out.
Thank you.